Now we're going to move on to the employee compensation and benefits package, based what it is now, what are the impacts of the market looking into next year as well. So,
All right. All right. Good afternoon, commissioners, our public that is here with us, all of my fellow employees that are here this evening, as well as our viewing public. My name is Lundy Covington, and I'm the HR Director for Cabarrus County. And my job this evening is to set the stage for a few topics we're going to present to you. I know this is going to be a long evening for you. Got it? So I promise to keep that very brief, but I just want to give a few facts before we roll into our speakers. So I've been with Cabarrus County. This is going into my 14th year. I have double that in total HR experience. And to say that this has been an unprecedented market in terms of wage growth is possibly even understated. It has been a definite challenge. Commissioners, you've heard from us a number of times over the last months about salary studies and things we're trying to do to keep up. But that's one piece of the equation. We're also seeing a lot of inflationary impacts that have been at high levels that are impacting things like health insurance that we'll be talking to you about this evening, as well as just the buying power of our dollar for all of the goods and services that employees consume. So just a few facts on our employee numbers. This information was pulled yesterday, so it's accurate as of yesterday. As we stand here today, we are talking about a total of 2,711 total employees on our rolls. That's a total head count, though, and that is going to include our Board of Elections individuals that help us out very rarely. It's going to include our seasonal employees for parks that will be starting soon and haven't come fully on board. So as we really look at the employees that will be impacted by some of the items we're going to mention tonight, that is basically going to be our full-time employee head count, and that is around 1237 right now. So just to kind of give you an idea of what that looks like. We typically talk about a 1,400-ish number. That includes full-time, part-time, and a few other smaller categories. The number that we equate to that is 1,345. So I just wanted you to have kind of a sense of where we're at as far as head count. The other number I wanted to put out there, we are in the process of pulling data for our budget conferences, and one of the items we'll have available is by department turnover. So that turnover varies widely by department. An overall turnover number, just to kind of give you a sense of where we sit today, this is going to be fiscal year, so running from July 1st to now, we're at 10% overall. So that's a better number than it has been in some years. It's certainly a worse number than years as well. That number is going to vary, though, widely between departments. I'm seeing some departments as high as 30% and others that are at 0%. So, just, again, give you some feel for data. One of the reasons we present this information is we want you to understand what we're being confronted with in terms of the labor market. So we're going to share 3 presentations this evening. The order has switched around a little bit. Let me see if I can pop those up. So we're going to start this evening with just an overview of compensation and benefits, kind of an internal total reward survey that our team prepared. Ashley Dobbins is going to be online, and she's going to provide that information to you. And we, again, are kind of presenting some survey data and asking for some guidance on some potential things we could take a look at. We're going to be followed then by our insurance renewal presentation by Larry, who's with us here in the audience. He'll come up and present. I believe at that point we'll have a dinner break, and then we'll come back up and we'll resume with McGrath Consulting, who will talk to us about some compensation work they're doing. So that's kind of the plan. I'm going to hang out up here as we turn over to Ashley. So if we're ready, Lauren, is she taking over control? All righty. Ashley Dobbins is our HR strategy manager for the team. So I'm going to turn it over to Ashley to lead you through some work her team has been handling for us.
Well, good evening. Like Wendy said, my name is Ashley Dobbins. I'm the HR strategy manager, and just want to thank you for allowing us some time to share about some total rewards research that the HR team has been working on in the past few months. It's been quite some time since we looked at some of our non-monetary benefits. So tonight we are going to share with you the benefits and rewards we asked other agencies about and how Cabarrus compares with what others are doing. Looking at our age demographics is valuable because it can give us an idea about what our team members may value most. As you can see, 41% of our staff fall into the millennial category, 39% into that Gen X category, 10% fall into Gen Z, and 10% in baby boomer. This tells us that about 90% of our workforce value things like work-life balance, flex and remote work options, and training and development. We reached out to the top 10 North Carolina counties, along with a few other direct competitors. We heard back from 15 similar or competing organizations, and you can see those here. Some of those included Concord and Kannapolis, Forsyth County, Met County, Rowan, Union, and others. Where we're looking really good compared to others: health and wellness programs with our on-site gym, the clinic, and the awesome wellness opportunities that Joanna and her team provide. The ability to earn comp time, with 90% of our staff falling into categories that value work-life balance and flexibility. This is a big plus. We are comparable to others in our volunteer service time and with our 401k program. And future opportunities may be to look at our tuition assistance program and additional military leave. Both of these are starting to see a trend of others doing more, but we aren't too far behind yet. So we have several areas where there are a majority of agencies doing some things that we aren't doing yet, and tonight we would like to share those with you. We know we may not be able to implement all of these, but wanted to share the research and get board input on which benefits we may be able to consider adjusting. So the first one that we learned about was floating holiday. All 15 respondents follow the state holiday schedule, with 9 out of 15 having their own unique additions. 9 out of the 15 have opted to incorporate either Juneteenth or a floating holiday, and others indicated they are hoping to add one of these as an option for their employees in the near future. The state began providing a floating holiday in 2022 under Governor Cooper's Executive Order 262. A floating holiday allows our employees to choose a day that may be of personal significance to them and their family. Some examples could be Juneteenth, Hanukkah, Indigenous Peoples Day, or many others that may be meaningful to our growing and diverse population. Other unique options shared from other agencies were the addition of wellness days and a birthday holiday. What we would like to propose is the addition of a floating holiday for our employees so that they can choose a day that is of personal significance to them. The next topic we researched was advanced holiday time. So this is time that is banked for our 12-hour employees to use either on the holiday or on a different day if they are scheduled to work. This mainly impacts our public safety folks. So for example, if a law enforcement officer is scheduled to work on New Year's Day, they could use their holiday hours for a Friday to have a long weekend. Our 8-hour employees have their full 8-hour shift covered on holidays when our offices are closed. We would like to propose increasing the holiday hours for our 12-hour shift employees so that their entire shift can be covered as well. And you can see on the chart that would be the equivalent of 144 hours per year in order to give 12-hour employees the full 12-hour day on their holidays. Fire is a little unique in that they work 24-hour shifts, so we would need to do a little more research on how many hours others are providing in holiday time for fire. With vacation accruals, we have not updated our vacation accruals since the late 90s, and we're falling behind in this area at every tier level. At less than 2 years, we are starting at 10 days, while the majority of agencies are starting with 12 or more. Between 2 to 5 years, we fall to the bottom, being the only agency who still offers only 10 days during those years of service. Between 5 to 10 years, we are the only agency offering 12 days, while others jump to 15 plus. Between 10 and 15, we're the only agency offering 15 days, while others have moved to 17 plus. Between 15 to 20 years, we are the only agency offering 17 days, while others have moved to 20 plus. And at 20 plus years, we're at 21 days, while the majority have moved to 23 plus days. So as you can see, the green trend seems to be around the average. So we've proposed an updated vacation time chart that reflects those accrual numbers. So you can see in this column, we have our current days, and then we have the proposed days based on what others are doing and how many days that would add to each tier of service. With changes to the 80-hour employee vacation accruals, we would also need to adjust 12-hour and fire accruals to equivalent days. And for recruitment purposes of experienced staff, we propose considering years of local government and state service and place that new team member in the appropriate accrual rate. So for example, if an applicant has 11 years of service with, let's say, Met County, and they want to come work for us, we could look at putting them in the 11-year vacation accrual, which would give them 18 days per year. Our sick leave bank is comparable to others. Survey respondents, 12 days per year is pretty standard. What we would like to do is propose to change the title sick leave and call it wellness leave to encompass physical, mental, and emotional well-being. 7 respondents have additional wellness time. We would propose just adding 2 days to our sick leave or wellness leave bank, if we can change it to call it wellness leave bank, for a total of 14 days, since the trend seems to be adding more wellness days. And for recruitment of experienced staff, we would propose allowing all sick accruals from other local government agencies to be added to the employee's bank. We currently only accept 20 days or 160 hours when somebody comes to us from another agency. So we would like to not put a cap on that any longer for recruitment purposes. Something else we saw that we felt was a really good idea was Forsyth County has reported that they are front-loading 6 days of leave to their new employees so that they have some time available in case of an emergency or sick situation. We would like to propose move into this model, as it would decrease new employee leave without pay situations and anxiety for our new team members when something happens that is beyond their control. This wouldn't be giving them any additional time, it would just be front-loading some of the accrued time that they would earn. And this would not be time used for pre-planned vacations. Bereavement leave. So 50% of other jurisdictions are offering paid bereavement leave for the loss of an immediate family member. We would propose offering 5 paid bereavement days for occurrence of death in the immediate family, capping that at 10 days per year. Our current definition of immediate family is spouse, mother, father, guardian, children, sister, brother, grandparents, grandchildren, or the variations of half, step, in-law, and adoptive relationships. And lastly, paid parental leave. 56% of jurisdictions are offering between 6 to 8 weeks. of paid parental leave for birth of a child or adoption. We would like to propose offering our employees 6 weeks of paid parental leave. And this is just a chart that kind of gives you an idea of how many leaves per year we have for paternity and maternity leave. Right now, our employees use their sick time, and so sometimes that gets depleted very, very quickly. And then if their child is sick later in the year, or if anything happens, they're out of time. Those were the benefits that we researched and wanted to share with you tonight. If you have any questions or feedback on any of those, we're happy to take those.
Ashley, this is Lynn. Do you have any numbers associated with the cost to make these changes?
Let me field that one. So we did talk to Rosh a little bit earlier today about the way to predict some of the cost. A lot of the benefits that we're looking at would be use it or lose it, and they would be limited impact. So, for example, Ashley's last slide showed you the number of people who needed that paternity leave. The one that would really have the highest price tag, so to speak, would be the vacation accruals, because that is something that, in addition to replacing sometimes people who are out for vacation and utilizing other staff or overtime, we would have a vacation payout. At this point, we felt like it was more important to get your feedback on what of these ideas, if any, you have an interest in us pursuing, and then we can put some numbers together and come back to you with that at a follow-up meeting.
I've got a question. Is the floating holiday that's proposed, is that in addition to the one the state already?
We did not adopt that,
Oh,
so
yeah.
we just have the traditional state days right now. There's not a floater in ours. The jurisdictions, and correct me if I'm wrong, Ashley, that added that, they have the state holidays plus a floater. So this would just give us that extra day as well to allow employees a day of choice. And we did actually utilize that several years back with a birthday holiday and have the ability to easily add that back into our timekeeping system, I believe.
Like,
Ashley, I didn't mean to cut you off. Add in, please, ma'am.
No, I said that's correct. Yeah, the ones they're all following state holiday, and they have added emergency for floating holiday.
so it's an addition.
If you're looking for feedback, I'll start with saying that this entire board, minus Commissioner Ferg, because you weren't on it, we set our entire mission and vision statement to put our employees first. At our last one, obviously with the current situation, I don't know if all these are doable. I mean, you can't. If you're looking for feedback, I'm in favor of the advanced holiday time. Having a history of working at a paid fire department for a living, I understand missing birthdays, holidays, special events, and that's just upping it from 8 to 12, correct? Just to cover those from an 8-hour day to a 12-hour day. And I'm also in favor of the bereavement one. I currently deal with that. I am a licensed funeral director and embalmer that works at a funeral home. 5 days, if we're talking about the big picture, from the time somebody passes to the time you get into an arrangement to the time you do a funeral, it's pushing it just for 5. And in that whole time, somebody's having to deal with issues going at home, issues going on at work, finding childcare. There's a lot that goes into a death that I personally see on a daily basis, because that's what I do. So I am in favor of the bereavement one, for the sole fact that at that point in time, somebody's entire life has stopped, let alone trying to figure out their paycheck. So those are the two right off the bat that I can see, possibly more, but with the current fiasco going on, that's still trying to put people first, but also trying to maintain a balance of where we're at. But for me, that's my feedback right off the bat.
So if no other feedback, I'll be here throughout the weekend if you have a chance and want to ask any additional questions. Again, what we're hoping to present this evening are ideas that tie to recruitment and retention. That is something that we understand the budget constraints. We definitely do. And I'm getting ready to present some information that will have more of a costing impact. But these were some items that were maybe on the lower cost side. What I would term a psychological benefit sometimes, because it might be a benefit that you don't even use, but because your employer has it, it's one of those that has some goodwill to it. And just to kind of tie to that bereavement example, right now we allow employees to use time out of their sick banks when they have a death in the family. What I think happens is that because sick time could roll into retirement, employees guard that very jealously, and they typically tend to not take the time off that they might need. So again, we understand some of these items are big asks, but again, just give us your feedback and I'll be here if you have any questions. So if we're ready to move topics. Sure, yep.
Was on the flooding holiday, it's part-time, has that been considered in?
So the holiday bank that we do right now, it's just impacts our full-time employees. That was that big number I gave you. And part-time staff that are 102 or work greater than 1,000 hours. So I think the same would follow. They get a prorated share. So if they work a 0.5 FTE or 20 hours and we have an 8-hour holiday, they would get like a 4-hour holiday. So if we added it, I would assume it would follow that same pattern. So it wouldn't impact anyone below a 102. Part-time greater than 1,000 hours.
So a question I had, Lundy, is, and you folks interview people and recruit people all the time. What kind of feedback do you hear from? I mean, maybe you don't hear feedback from people. Maybe you make an offer and they just say no, thank you. Or do you hear some of these things from folks?
We do. And some of these ideas surface from conversations with our HR team, particularly those on the recruitment side that are making those job offers. And they're hearing that my current employer offers X in vacation, you only offer X. That's an issue. Or with sick time, can I carry over sick time? And we have a limit on that. So part of it is feedback there from our HR team. Part of this is feedback from our employee survey. If you remember, we started our retreat portion last year with feedback from employees. We didn't do that this year. It'll be happening again in the fall. So it's feedback from existing employees, HR staff, applicants, and people we maybe lose in the process. And then in addition, trying to see where we compare to our neighbors. We compare our compensation often to them, but we haven't really taken the time to do a benefits deep dive. So again, that was our purpose in just letting you know how we shake out with our neighbors in those other top counties.
Yeah, and I certainly agree with what Commissioner Wortman said earlier. We talked about this extensively at our retreat last year, and of course, we're in the business of providing service to the public, to people. That's the reason we exist. And if we don't have good people, we can't do a good job at that. So I think we placed a priority on that. And also, I've heard Commissioner Shue say many, many times, and I certainly agree with him as well, the cost of recruiting and training new employees when they're constantly turning over for whatever reason is extremely more expensive than whatever efforts we might take to make people happier and retain them. So in the feedback area, those are my thoughts. I think that we need to explore. I mean, I look at it not so much as an expense, but a potential savings, that by investing in our employees, we can save money in the long run by providing stability and reducing turnover and those kind of things. So that would be my thoughts on it.
Absolutely. Cost avoidance if we can retain. And I am pleased that our number overall is only at that 10% mark. It could be better, but I think in times it has been worse. And I think part of that is attributed to some of the things that you voted on to allow us to do to make wages better in certain areas. So we're appreciative of that.
And Lundy, another thing too, I had another meeting earlier this week where I was meeting with some prominent people in our community, and we were talking about comparison between Cabarrus County and other counties that we, believe it or not, it is competitive because we hire people. We spend our money to teach them what to do and train them to do the job that we hired them for. And then they'll go to Mecklenburg or Rowan or somewhere like that. The instant that this one guy gave me that we were talking, he said, Lynn, look, we hire them for $42,000 a year. But they can go across the line over there and get $65,000 a year doing the same job. Obviously, we can't compete with that type thing. And I think I told the chairman the other day, I said, keeping up with the Joneses, you'll go broke sometimes. But we have to be competitive, though, because if we don't have the people, we can't do the work. And I'm just like Commissioner Wortman said, we need to put you guys, our county staff, up front. I believe what President Trump says, America first, Cabarrus County first, our people first. And that's a philosophy that I have. And there are other areas that we can look at being a little tighter on, you might say. But when it comes to you guys, we want you to stay here, and we want to take care of you. We want you to retire with us. But we want you to hire your replacement, too. It's not really, when you leave, you have to bring your clone yourself in. But anyway, I just want us to do what we can for everybody. And I don't have any problem with any of the issues you brought up. Big ticket is how much of a financial strain is it going to put on the county? And that's what I'm looking at that too. We've got to look at all angles.
We'll work with Rosh and see if we can put some numbers to it, some better estimates for you. But again, a number of these items are limited impact because they won't be across the board. So we'll work on that. Okay, are we ready to move to the health insurance topic? So we'll ask Larry Reese with USI to come up and join me, and Joanna Ray, and they're going to take us through a presentation on our health insurance renewal as well as some dental information. Larry, I'm going to slide aside for you.
Wait 10 minutes.
Top it.
Oh, that's what we said.
Good evening, everybody. My name is Larry Reese with USI. I am your current employee benefit consultant and broker. I work in a team with two other colleagues, Linda Klein and Katie German. They could not be here tonight, so you guys are stuck with me. It's a pleasure to be here. Thank you for having me. I've got 6 or 7 slides to go over in a PowerPoint presentation that speaks to your medical and pharmacy program, so your primary and lead employee benefit. And then we'll take a look at dental. It's also in the theme of how competitive are you? So I'll call it benchmarking of your plan designs. And let's see if I can use the clicker. Great. So we're going to just peel back the onion a little bit. I'll start with some words, and then we'll have a word picture that'll make all this come together a little cleaner. You have 2 medical plans today, what's known as a high deductible health plan, a qualified high deductible health plan, and then you have an OAP, Open Access Plus. It's Cigna's term. So your medical carriers, most everybody in the room knows, is Cigna. You have 2 medical plan designs. The IRS dictates the plan design, which is what makes it a qualified high deductible plan. And there is going to be a change coming up for you. The deductible on the high deductible health plan will go from $1,500 to $1,600. That's the third bullet point on this particular slide. And because of that, Cabarrus County doesn't have a choice. Any plan sponsor out there who offers a qualified high deductible health plan, the minimum deductible goes up slightly. So this is a mild takeaway and benefit, if you will, and that's valued at $63,000. Your high deductible plan tracks nicely in terms of comparing against others who offer that plan. So no suggestions today to change that plan other than what's required by law. Under the OAP plan, you have an actuarial value of 71, and benchmark data would tell you that that plan's undervalued, meaning the design features of that plan, the deductibles a little too high, the copays are a little too much. So if you wanted to improve that plan, you could make the deductible lower, add some copays, and we're going to get into that next. Sorry for the actuarial value, but what it really does is it takes all the benefit features, rolls them into one expression, and it makes it easy to go, how's my plan compared to any other plan offered that's an OAP, PPO type plan? Just a table set also of the two medical plans that you have, you might not be surprised to know that 78% of your employees are in the high deductible health plan, and 22% of all of you guys are enrolled in the OAP Open Access Plus program. This is just a word picture for you that the last slide went through, but essentially, if you were, who am I benchmarking against? And other employers with at least 1,000 employees, county government in the Southeast and in the Mid-South, regardless of whether it was a public entity, municipality, just an employer. And so you gain a sense for your two plans, or the two in blue, and then 4 different benchmark data points that give you some sense of your program on a roll-up. So just a good visual aid to tell you, how does my medical plan offerings compare against others? And so now a lot of detail, right? So we gave you actuarial value. You might say, well, if you were going to improve it, what would you improve it against, and what elements would you improve? So sorry for the eye test if everybody can see this, but again, 3 benchmarks. The one in the middle is county government. So your column 1 in blue, the Cigna OAP plan. And so the potential opportunity for the group is to consider improving the Cigna Open Access PPO plan from a $2,000 deductible that's something's closer to county government norm, $750. So, and then the same on the family out-of-pocket from $4,000 down to $1,500. So we've got some recommendations coming. You might say, where did those recommendations come from? Clearly, it came from this page. So in the name of recruiting and retention, you might consider improving a medical plan offering that's more in line with market norms for the 22% of the people currently electing the Cigna OAP plan. And happy to walk you through any additional granularity there, but I'm going to pause and let everybody kind of absorb kind of the PCP copay today is 30. Other municipal governments are closer to 25. There is a $30 in the Mid-South, but 2 of the 3 benchmark data suggested that copay is $5 too high. So I think you get the hang of where we're headed with this, and I'll skip to, let me go back. There we go. So there's 2 paths forward for your medical plans. You could stay on the current path with no changes other than what's required under the IRS guidelines for the deductible. The second path forward would be some improvements. Those improvements have a cost. The cost estimate of those improvements is about $350,000. And what would those improvements be? Let me walk you through them now. We would suggest that you adjust the deductible from $2,000 down to $750 for a single individual. For tiers other than single, the family deductible would go from $4,000 down to $1,500. And then same for out-of-pockets. The out-of-pocket would have an improvement for a single individual covered under that plan. The annual out-of-pocket maximum would come down from $6,150 to $4,000. And then the $12,300 for family out-of-pocket would come down to $8,000. And then a host of copays. The primary care copay would improve by $5 from $30 to $25. The specialist copay would move from co-insurance after deductible to $38. A tremendous opportunity for improvement. And then the emergency room visit would also move from co-insurance to deductible. And then under pharmacy, the preferred brand copay would have an improvement from $55 to $30, and the non-preferred brand copay from $70 down to $50. So considerable improvements to that plan. In cost estimate of around $350,000. So two paths forward: current or these improvements for the OAP plan. Either way, the high deductible health plan will need to adjust based on IRS guidelines. And then so just another word picture and visual aid. Sometimes it's just easier. Hey, could you put all that in a chart? Let me see what's out there today, and let me see what you're maybe suggesting for tomorrow. And so this chart kind of does that. On the left side of this chart are the two current plans today: HDHP, high deductible health plan; OAP, Open Access Plus, both with Cigna. Tomorrow, on the right, in the shaded blue area there, the same two plans deployed. The only change to the high deductible health plan is that you have to raise the deductible to IRS minimums. And you see that highlighted and then put in bold font. And then in the OAP plan, you see the improvements all kind of scored there. This is clearly not the entire coverage document, but at a high level, these are the benefit features that drive consumption and that suggest satisfaction with the plan design. So happy to pause there. I think there's maybe, so a roll up on total cost. So at the top of this page is current cost. So what do we spend today? What do we budget today? And how might that compare to what we might do tomorrow? The first row is current fiscal year and what you budget today, $14.4 million. Of that $14.4 million, the employees pay about $1.4, which means the county picks up 90%. If you kept the two current plans in place today and you only made the one change, the IRS required change, then next year's budget would be something in the magnitude of $15.8 million, of which the county would pick up about 91%. And then the recommendation was to hold employee contributions at zero, so employees would still pick up about $1.4 million. And then if you made the plan design changes, again, we said that would cost about $350,000. There'd be a little bit of migration towards that plan with the improvements. People might leave the high deductible plan and choose to join the open access plan because of the improvement. So the 78% enrollment might have some percentage that will join the 22% that are currently enrolled in that plan. And if that took place, this might give you some sense of what the budget would be. $16.2 million in total. Contributions from the employees through payroll deductions would stay the same. And therefore, the county would pick up about 91.4%. And the budget increase would be about $1.8 million compared to the 1.36. So that's the suggested changes that you might consider in order to approach market norm for your medical OAP plan. And I'll quickly share with you dental. Sorry, again, maybe for the eye test. This is the fully insured rates that are actually the GOST conventional equivalent rates that you guys pay because it's a voluntary program. The county doesn't fund this program, and that's going up about 16% based on consumption. And every client I have across the board, dental costs are way up. What we thought would happen post-COVID did not, and it's happening now. So essentially, hey, Larry, tell me why that's happening. Dentists lost a lot of hygienists and a lot of staff. And a lot of folks that could leave the industry left the industry. They didn't want to remember all the equipment they had to wear as practitioners. They didn't want to wear the equipment. They didn't want to be exposed to COVID. And so they just retired or left the industry and chose to do something else. Because of that, the pent-up demand for dental care that we thought would happen, the demand was there, but the supply wasn't there. There weren't enough hygienists to perform what needed to be done or dentists. So the supply has fixed itself, and the demand is now flowing through the system. And so across the board, every client I've got, whether they're municipal or private, whether they're fully insured or self-funded, dental claims costs are up. Dental should run 3 to 5 to 6% a year. This is a 16, and it's pretty much in line with what we're seeing. So I am happy to take questions, or what's the will of the group? Employee funded at 100%. Yeah, there's you see there's a column in here, county portion, Cabarrus County portion, and that's at zero, and the employees pick it up. So that increase, that 16% increase is $4.21 for a single, And for a family on the other end is 16% equates to $14.75 per employee per month. And of course, that's done on a pre-tax basis.
I guess the question that I would have is you talked about the $347,000 increase, and that would be applied to how many employees? I'm a little confused and flipping back and forth from plan A, plan B.
Yeah, I apologize for the confusion. Good question. So 22% of the enrollees take that plan, but we think with the improvements, you'll get some people leaving the high deductible health plan to join that. Hard to give you an exact number on that, whether that's 30 employees or 50 employees, but you will get some migration.
So when that migration happens, that $347,000 price is going to go up, right?
No, that's attempted to allow for some.
Anticipating that.
Some migration priced in.
Yeah, well, that's pretty substantial. You're talking about the deductible reducing from $2,000 to $750. I would think a lot of folks would find that very attractive.
I agree. But remember, on the high deductible health plan, if they've also had some money set aside there, they've got some savings. They probably don't even have a deductible on that.
From their HSA, so health care savings account, perhaps, which only applies to does apply to the high deductible.
Yeah,
currently.
two different. Let me take us back for visual aid purposes. Here we go. Is that helpful to you? So the deductible would move from $1,500 to $1,600 on the qualified high deductible health plan.
Right.
Right, and so they have some HSA seed money.
Or
in past years.
But if they wanted to switch over to the other plan, it would drop to $750.
Yes, that's exactly right.
Right. And the rest of the benefits would be pretty comparable.
Well, it's their first dollar, so you're moving some things to copays that weren't, which the specialist used to be deductible and then 80%, and now it's going to be copay, which that's a dramatic improvement.
Right. Thank you.
Have we had any complaints with the health care coverage that we have?
Oh, yeah. So we've always had with the open access plan over the years, that one has diminished over the years. And so employees have commented on, the lack of plans, especially during new hire orientation. We get people from private industries, public coming in, very surprised at the plans that we have offered, especially the, open access. I did have a gentleman call me this past week in transportation. He's on the OAP plan, and he has a specialty visit he has to go to, and he was asking, the provider what the cost will be, and it falls under the deductible and copay, and that particular person just could not afford, that visit. So there are a lot of employees that comment on that.
By a show of hands in the room, since we have a room full of department heads, would you please raise your hand if this type of benefit is important to keeping you to Cabarrus County? Because it's one thing for us to sit up and hear it from somebody else, but it's another thing when we have a room full of people that's telling us that this is what keeps you staying here. So that, or from leaving. So I appreciate you raising your hands.
Do you have any other questions about the plan or?
Okay, so we are back to the second part of our human resources presentation, and we have another guest speaker who is going to be remote this evening. Victoria McGrath has been working with us on a salary structure project, and she is going to share that information with you. I did get some feedback from Ashley. She could not hear the commissioner's questions, so I'm going to relay any questions that you have to make sure Victoria can hear those loud and clear. So she's going to be controlling her own slides. So I'm going to step aside and turn it over to you, Victoria.
Great. Thank you very much. And hopefully this works. And I agree. And your dinner looked very good and it now has me hungry. But I'm Dr. Victoria McGrath. I'm CEO of McGrath Human Resources Group. And we were asked to come into the county to take a look at the salary schedule itself and then conduct a market study for public safety positions only. So I'm going to kind of give you a high level of what we've done, how we've done it, where you stand, and where we need to go in the next direction. For those of you that don't know anything about us, McGrath Consulting was established in the year 2000. So May of this year, we'll be celebrating our 24th anniversary in business. There are two sides to the business, and the only reason I mention this is McGrath Consulting, Inc. is the parent company, and that does public safety consulting. So we do police, fire, EMS, and dispatch from the county level on down. And then we broke off in September of 2012 to McGrath Human Resources Group because people thought we only did police, fire, EMS, and dispatch. But yet we look at human resources issues from the county on down in all groups within the county, not just in public safety. Currently, to date, we have over 550 clients in over 40 different states. We are definitely, this is not our first compensation plan by any stretch of the imagination. The bulk of our work is done with public sector organizations only. And the only reason I say the bulk of it is on the fire side. We sometimes end up working with fire districts, fire authorities, wastewater districts authorities that may be private organizations that can't get their funding through tax dollars. So what were we asked to do? We were asked to take a look at the current compensation plan. Your model is somewhat a little bit old in the respect that all the pay grades have 5% between each pay grade. That was a model that was used a number of years ago. It makes for a lot of pay grades when you're only doing 5% apart. And so the county thought that maybe we should look at maybe increasing that percentages between grades in order to provide more flexibility within the system. In addition to that, we were looking at whether or not the positions were market competitive for public safety positions only. So we only did a market study for positions that were sworn and non-sworn in both departments. Then obviously, we're supposed to take that public safety data and then integrate that within the county system. So the question becomes when we're looking at your plan, what we did not do is we did not do a compensation study for non-public safety positions. So as we're looking at this, I am looking at the current salary ranges that are already established because those have gone through market studies over the last couple of years. And so we did not get any data to say, this position should be moved to a higher pay range because it's no longer market competitive. We did this through a lot of different methodologies. Number one is we had interviews with county administration to make sure we understood the scope and breadth of the study. And then we met with department heads and managers because even though we've worked in numerous organizations, and in fact, I'm working right next door to you, Union County as well, your positions may be different than their positions or other positions within county government. And so by sitting down and saying, okay, I'm going to pick on an equipment operator, what does an equipment operator do? Well, in some cases, an equipment operator is a light equipment operator. Some cases it requires a CDL. Sometimes it deals with very high level technical equipment. In other cases, it could be a solid waste truck driver. So by talking with individuals, we were able to figure out what types of positions we were looking for in order to make sure we compare them internally within the salary schedule, or for public safety, we had similar positions to the external market. We then asked employees to complete a position questionnaire. A position questionnaire is an online document that gives us significantly more information about a position than a job description does. It basically takes a job and it divides it and evaluates it into 13 different competencies.
It's through that mechanism that we can look at positions within the organization and determine, are they similar, are they different, should they be in the same pay range, or should they be in something different. Obviously, we collected your compensation system, job descriptions, current policies, so that we understood what the county was doing at this point. And for public safety, we went to 19 different organizations and collected the minimum, midpoint, maximum, and incumbent salary data. And hopefully you can read that. If not, there will be a report that will eventually come out that has the list of the organizations that are in there. When we look at those organizations, and this is going to be kind of geared right now just strictly for public safety, one of the things that we do is we establish something called a comp ratio. A ratio basically means that what is your minimum of this particular position's salary range to the average market minimum of the comparator group. And so typically when you do that, we say 50%, you're at market, that's where you should be. And but then we establish a little bit of a range around that, because obviously you can never get to the exact number of what the person is making. And so therefore we establish a range. Now, if you are lower than a 45% comp ratio, that position is deemed to be out of market and needs to be adjusted. If it's 45% and above, it's deemed to be within market standards or within market parameters. When we do establish that average market rate, however, we will eliminate any outliers. So we look at each data set and say, okay, is there any market data that's too high or too low that's going to skew that market average? And typically we look at 1 to 2 standard deviations away from the average to determine whether or not that is relevant data that we should be using. I've been saying this for 24 years, so this has nothing to do with the group sitting here, but the group sitting here wants to make sure that I have all the low-paying municipalities in, and employees want me to have all the high-paying municipalities in, and that'll make either one of you happy. I'm going to eliminate those so that we can look at how the true average. So looking at the public safety positions, 72% of the positions that were benchmarked are under market. They are under that 45% comp ratio and really need to be aligned. There are some, however, that are okay. 28% of them are aligned with the market and really requires very little minimal adjustments to them. But obviously, I'm sure this is no surprise to anybody, as within public safety, it's now become a bidding war. Who can pay the highest at this point in time? And so you have obviously fallen outside of that market rate. We looked at the midpoint of the salary range because in theory, the midpoint of the salary range should represent the average market rate. The average market rate means that a person should be reaching that range within 3 to 5 years. That means they're fully capable and confident of doing the job. And in this case, and for this case, the midpoint of that salary range does not represent the average market rate. So 72% of the positions do not align from the midpoint of your range to the average market rate. So again, your schedule is not exactly in line with the external market. Sometimes, however, salary ranges and the evaluation of salary ranges can be deceiving because what you've been providing employees in the way of compensation may not be as outside of the market as you think. Unfortunately, that's not the case. And so 75% of current employees are being paid under the average market rate. Now, with that being said, when you look at this graph, I would anticipate and expect to see people with the 30 to 44% comp ratio because you do have a number of new employees. And those employees should be at the lower end of the salary range. And these folks would not necessarily be considered outside of the market because they're at the lower end of the range. And they have to, work so while to get their way through that. However, this group of folks in the 0 to 19 and 20 to 29% are those folks that obviously they're in salary ranges where they're at the lower end of the salary range, and that's lower end of the salary and is not competitive to the market. And so obviously there's going to need to be some significant adjustments when it comes to the public safety positions either within your current schedule or within the salary schedule that we are going to be recommending. So let's talk about the county as a whole now. So looking at your salary schedule as a whole, number one, as I said before, we're at 5% pay ranges, which causes a lot of compression. It creates a lot of pay ranges. And one of the things when we met with each department director, a lot of my notes indicate that one of the problems they had with the salary schedule is that there's no room. There's no room in between these ranges. So that obviously was the ultimate goal of the study. However, there's a couple of things that are happening that are causing the recommended schedule to have some issues. And this is one area where we're seeing all over the country, it's not just unique to your county, is that you've got the lower end of the salary ranges are moving extremely fast. At one point in time, it was not unusual to have the lower end of the salary range at $10, $12, $13. Well, let's put it this way. At $10, $12, $13, I'm not even sure you can compete with McDonald's at that. So the lower end of the salary ranges are really popping up. And, we're starting salary schedules now, $15 and $18. And recently, some of them are starting at $20 because that's what your external market is showing for that lower level class of employees. So that's really pushing the bottom of the schedule up. And then what's happening is, in your case, a lot of the departments are wanting to create or have career progression levels. Well, the more levels you create on a higher starting salary base is now pushing the upper end of your salary range when you're getting into your professional and your department head positions over the market, because we're now trying to fit in all these levels in a space. And even if you went back to 5%, you're still going to have that same issue. So if we could reduce some of the levels that some of your departments are trying to put in, create larger percentages between the pay grades, you're going to have more room to grow, and you're actually going to have a better salary range as a result of it. So when we create levels, one of the things that we're really going to have to take a look at and maybe push back to some of the department heads is what's the difference? How do I get to that next level? What is it that's different about the job? It's not just because my butt's in the seat for 5 years and now I go to 6 years and I miraculously move to the second level. But is there any type of education, certifications, training, licensures that people get that then move them into that next pay range, and then additional responsibilities are then added to that? So we're going to have to kind of take a step back and say, well, I'm not going to move just from a junior level to a senior level because I have more complex work. Well, what does that mean? And you can run yourself into problems if you don't have some very structured criteria that says I can go to this range to the next range. So we're going to have to take a look at that and then determine, do we stay with larger percentages between the ranges, or we go back to the 5% so we can fit in all these levels that we need to have? Taking a step to the side, we did do a little bit of employee demographics. This is always kind of nice to have, so you know kind of how your salary schedule is impacting your employees. Right now, your age group, age 50 and over, has the longest tenure within the organization and represents 32% of your population, which means that right now your average years of service is 6.47. You're just slightly below the Bureau of Labor Statistics years of service for local government, which is 6.99. So it's not that bad. What I will say is your average years of service is to decrease as this population of age 50 and over decides that they want to retire and do something different in their lifetime. And so you will see that number obviously go down. What's going to be interesting for you is that you do have a large set of employees, 40 and over, but you also have 44% of your population under the age of 40, and most of them have 5 years or less within the organization. And this is the group that's considered to be more vulnerable. I had a client one time call them my shiny object organization or generation. They're going to go, and if I can get $1.50 more across the street, I'm going to go, whether it's another municipality or whether it's the Quickie Mart. And so the question's going to come, it was in your salary schedule, and what are you going to do to make sure that those folks are going to stay within the organization? Because obviously turnover is expensive. So, when you have turnover, the question's going to be, what is it that's going to keep them? What's the hook that's going to keep them with Cabarrus County versus going someplace else? And so, that kind of goes back to what's your compensation philosophy. And right now I am assuming that your compensation philosophy is to remain on the average market rate. And that's what it looks like it's doing. We do have some municipalities right now that are saying, because competition for employee resources is so tight, we want to be higher than average. We want to look at the 60th, the 65th, or the 70th percentile to build our salary schedule on so that we have that competitive advantage. I will tell you that your neighbor, for the most part, once we get to a certain point within the salary schedule, most of their professional positions on up are most likely at the 70th percentile of the market at this point in time. So here's what we're going to do, or at least what I think we're doing. Is right now I have built the salary schedule for all positions within the county and have slotted public safety in accordingly. And there's 8 to 10% between the ranges. There is a little bit of variance in that because one of the things that we're really looking is compression between the ranges. It might be slightly higher than 10% if we're getting to a group, because one of the things I'm always concerned about, if I'm at this level and I take a supervisor position, when does the superior position supervisor have a salary range that's greater than the positions that they actually supervise? And so sometimes you have to vary that percentage between 10, 12% in order to get that. This does reduce the number of pay grades that the county would have within the system. The other thing that we've done is we've looked at positions and we've looked at the point factor system. And as you can see on the screen, these are the categories in which a position is evaluated. And so right now I have a rough idea of what the points are for the position and where it should be placed. So because this was not a market study for the entire organization when it came to positions outside of public safety, I don't really have an external market to go to. I am using the current salary range and trying to fit it into a range in the recommended schedule that's close to that current salary range. So we've done that. We've looked at the position analysis, and so is there anything that says, oh, wait a second, this point factor is extremely high compared to the pay grade that it's in. Is there some reason that we might need to change a pay grade for that position? You are also reaping the benefits of Union County because we have just finished their salary schedule. They have made some minor tweaks to it, and we did do a full market salary survey with Union. And so therefore, if there are positions that are comparable between the two organizations, trying to make sure your salary range is close to that. Because one of the things we don't want to do, and I'll pick on public safety, is we don't want to have a deputy sheriff making, $10,000 more in one county versus the other, and then obviously you're stealing employees from each other. So when positions do align, I did take a look at where they are in relationship to yours. You're not exactly the same. You're going to be, maybe $1,000 off one way or the other, but at least, you have that advantage of where they're placing their folks. And obviously, the market data was used for the public safety positions. So here's what we've got for it is that two things. Number one, on the public safety side, there's been a concern by county administration to maybe do something a little bit quicker on public safety than it is for the rest of the organization. So this week I did fit the the salary data, the external market data into your current salary schedule, and then calculated what it would take to get people to the minimum of that new schedule and established a very rough cost for that. The cost itself is not that bad. What we're going to have to take a look at, however, is since those salary range have increased so much. For example, I think one of them went from pay grade 13 to pay grade 19. You're going to have to look at all the current employees and where they are within the salary range. Because if all of a sudden that new minimum is really close to people who have been here for 2, 3, 5 years, you know, you've got, bring to mind, I don't have a hiring range anymore because your current employees are clogging it up. But you're going to have to then say, how much is it going to cost to move some of your current employees further within that salary range so that you can use the range that has been established for that. And that costing has not been done at this point in time. Then, looking at the schedule for all employees or all positions within the county, recently Human Resources went and took some of the recommendations to the departments. They have provided me that feedback. I have not started to integrate that feedback into the schedule yet, but I will say that I glanced at a few of them, and some of them say, well, this position should be paid higher at this pay grade. Well, if there's not supporting data to say why it should be paid higher than the current salary range, I'm probably not going to move it because I don't have any data to support why that position should be paid higher. So we need to take a look at that. And then I'm going to have to try to reconcile, now that these levels have come in, how are we going to fit all these levels in with the recommended schedule? Do we need to go back to a 5% salary range, or can we keep the 8 to 10%, which gives you better salary ranges, or can we use the range? You know, sometimes you forget to use the range. So if I go from a level 1 to a level 2, why do I have to have a new salary range? Why can't I go from the midpoint to the maximum of the salary range? So that's kind of the issue that we are kind of stuck at right now. And after your retreat, hopefully we'll have better ways in which to address what do we do with the entire schedule. So I'm going to stop sharing and I'm going to stop talking. And if you have any questions, concerns, this is clear as mud. I'll be more than happy to entertain them for you.
And just to speak to the timeline a little bit, because I know Dr. McGrath alluded to some work that's ongoing, our goal would be to bring the public safety information to you at your March meeting when the costing has been built out, so you have a better idea of that project. The full salary schedule we would anticipate bringing to you at a future meeting. The goal with that would be, if we implement, it would be something we do in the FY25 budget. So it would be past the July point. Are there questions, though, while we have Dr. McGrath that we can put to her this evening, or do you need more time to digest this? And again, we anticipate having her back with us in March for your work session.
Very good.
Okay, thank you.
Okay.
Appreciate it.
Thank you very much. Enjoy your retreat and have a good weekend.
Yeah.